The orbit is a
pyramidal bony cavity in the facial skeleton, with its base anterior and its apex posterior. The orbits contain and protect the eyeball and their muscles, nerves, and vessels together with most of the lacrimal apparatus. The bones forming the orbit are lined with periorbital, which is periosteum of the orbit, which forms the facial sheath of the eyeball. The periorbita is continuous at the optic canal and superior orbital fissure with a periosteal layer of gira. The periorbita is also continuous over the orbital margins and throughout the inferior orbital fissure with a periosteum covering the external surface of the skull. The orbit has four walls and an apex. The superior wall is approximately horizontal and is formed mainly by the orbital part of the frontal bone, which separates the orbital cavity from the anterior cranial fossa. Near the apex of the orbit, the superior wall is formed by the lesser wing of the sphenoid. The lacrimal gland occupies the fossa for the lacrimal gland in the orbital part of the frontal bone. The middle wall is formed primarily by the ethmoid bone, along with contributions from the frontal, lacrimal, and sphenoid bones. Anteriorly, the paper-thin medial wall is indented by a lacrimal fossa for the lacrimal sac and the proximal part of the nasolacrimal duct. The medial walls of the two orbits are essentially parallel, separated by the ethmoidal sinuses and the upper nasal cavity. The inferior wall is formed mainly by the maxilla and partly by the zygomatic and palatine bones. The thin floor is partially separated from the lateral wall of the orbit by the inferior orbital fissure. The inferior wall slants inferiorly from the apex to the inferior orbital margin. The lateral wall is formed by the frontal process of the zygomatic bone and the greater wing of the sphenoid. The lateral wall is thick, especially its posterior part, which separates the orbit from the middle cranial fossa. The lateral wall of the two orbits are nearly perpendicular to each other. The apex of the orbit is at the optic canal in the lesser wing of the sphenoid just medial to the superior orbital fissure. Take a look in your atlas. The orbital cavity, which is known as the eye socket. The eyelid and lacrimal apparatus. The eyelid and lacrimal fluid, which is known as tears, secreted by the lacrimal gland, protect the cornea and eyeball from injury, such as dust and smoke particles. The eyelids, when closed, cover the eyeball anteriorly, thereby protecting it from injury and excessive light. Mention they keep the cornea moist, spreading the lacrimal fluid. The eyelids are movable folds that are covered externally by thin skin and internally by palpebral conjunctiva. The palpebral conjunctiva is reflected onto the eyeball, where it is continuous with the bulbar conjunctiva. This part of the conjunctiva is thin and transparent and attaches loosely to the anterior surface of the eye. The bulbar conjunctiva, loose and wrinkled over the sclera where it contains small apparently blood vessels, is adherent to the periphery of the cornea. The lines of reflection of the palpebral conjunctiva onto the eyeball form deep recesses. The superior and inferior conjunctival cornices. The superior and inferior eyelids are strengthened by dense bands of connective tissue, the superior and inferior tarsal blades, which form the skeleton of the eyelid. Fibers of the auricularis oculi are in the connective tissue superficial to these plates and deep to the skin of the eyelid. Embedded in the tarsal plates are tarsal glands, the lipid secretion of which lubricates the edges of the eyelids and prevents them from sticking together when they close. The lipid secretion also forms a barrier that lacrimal fluid does not cross when produced in normal amounts. When produced in excessive, it spills over the barriers as tears. The eyelashes are in the margins of the lids. The large sebaceous glands associated with the eyelashes are ciliary glands. The place where the eyelids meet is the angle of the eye, canthus, corner of the eye. Thus, each eye has medial and lateral angles or candi. Between the nose and the medial angle of the eye, and let me correct this. Between the nose and the medial angle of the eye is the medial palpebral ligament, which connects the tarsal plate to the medial margin of the orbit. The orbicularis oculi muscle originates and inserts onto this ligament. A similar lateral palpebral ligament attaches the tarsal plates to the lateral margin of the orbit but does not provide for direct muscle attachments. The orbital septum is a weak membrane that extends from the tarsal plate to the margin of the orbit, where it becomes continuous with the periosteum. It contains orbital fat and can limit the spread of infections to and from the orbit. The lacrimal apparatus consists of lacrimal glands, which secrete lacrimal fluid, lacrimal duct, which conveys lacrimal fluid from the lacrimal gland to the conjunctiva sac, lacrimal canaliculi, is commencing at the lacrimal punctum on the lacrimal papilla near the medial angle of the eye, which conveys the lacrimal fluid from the lacrimal lake, a triangular space at the medial angle of the eye where the tears collect. In the lacrimal sac, the dilated superior part of the nasolacrimal duct, which conveys the lacrimal fluid to the nasal cavity. The lacrimal fluid usually flows from the lacrimal duct across the eye to the lacrimal lake. The tears enter the lacrimal sac and then the nasal cavity, where they flow to the back of the nasal cavity and are swallowed. However, when the tears increase as a result of emotion or other causes, they flow anteriorly over the lipid barrier on the edge of the lid and onto the cheeks. The lacrimal gland, almost shaped and approximately 2 centimeters long, lies in the fossa for the lacrimal gland in the superolateral part of each orbit. The gland is divided into superior orbital and inferior palpebral parts by the lateral expansion of the tendon of the levator palpebrae superioris. Accessory lacrimal glands are also present. They are more numerous in the superior lid than in the inferior lid. Lacrimal fluid, the production of which is stimulated by parasympathetic impulses from CN7, enters the conjunctiva sac through up to 12 lacrimal ducts that opens into the superior conjunctival fornix, the superior line of reflection of the palpebral conjunctiva to the eyeball. The conjunctival sac is the space bound by the conjunctival membrane between the palpebral and vulvar conjunctiva. After passing over the eyeball to a large part of the way the eye closes from lateral to medial, the tears enters the lacrimal lake at the median angle of the eye, from which they drain by capillary action throughout the lacrimal punctum and lacrimal canaliculi to the lacrimal sac. From this sac, the tears pass to the nasal cavity throughout the nasolacrimal duct. When the cornea becomes dry, the eye blinks on the eyelids carry a film of fluid over the cornea, somewhat like the car wipers wash the windshield, and in this way, foreign material such as dust is carried to the medial angle of the eye where it can be removed. The nerve supply for the lacrimal gland is both sympathetic and parasympathetic. The presynaptic Parasympathetic sex growth to motor fibers are conveyed from the facial nerve by the greater petrosal nerve and then by the nerve of the pterygoid canal to the pterygopalatine ganglion, where they synapse with the cell body of the postsynaptic fiber. Vasoconstrictive postsynaptic sympathetic fibers growth from the superior cervical ganglion by the internal cavity plexus and deep petrosal nerve join the parasympathetic fibers to form the nerve of the pterygoid canal and transverse the pterygopalatine ganglion. The zygomatic nerve from the maxillary nerve brings both types of fibers to the lacrimal branch of the ophthalmic nerve by which they enter the gland. The orbital contents are the eyeball, optic nerve, ocular muscles, fascia, nerves, vessels, fat, lacrimal glands, and sac. The eyeball has three layers. One is the outer fibrous layer, which is known as the sclera and cornea. The middle vascular, which is pigmented layer, is the choroid, ciliary body, and the iris. The inner layer, which contains the retina, consisting of optic and non-visual parts. The outer fibrous layer of the eyeball, the sclera, is the opaque part of the fibrous coat of the eyeball, covering the posterior 5/6 of the eyeball. The anterior part of the sclera is visible through the transparent bulbar conjunctiva as the white of the eye. The cornea is the transparent part of the fibrous coat covering the anterior 1/6 of the eyeball. The middle vascular layer of the eyeball, the choroid, a dark brown membrane between the sclera and retina, forms the largest part of the vascular layer of the eyeball and lines more of the sclera. It terminates anteriorly in the ciliary body. The choroid attaches firmly to the pigment layer of the retina, but it can easily be stripped from the sclera. The ciliary body, which is muscular as well as vascular, connects the choroid with the circumference of the iris, falls on the internal surface. The ciliary processes secrete aqueous humor, which fills the anterior and posterior chambers of the eye, fluid-filled spaces. The anterior chamber of the eye is spaced between the cornea anteriorly and the iris pupil posteriorly. The posterior chamber of the eye is between the iris pupil anteriorly and the lens and ciliary body posteriorly. The iris, which literally lies on the anterior surface of the lens, is a thin contractile diaphragm with a central aperture, the pupil, for transmitting light. When a person is awake, the size of the pupil varies continually to regulate the amount of light entering the eye. Two muscles control the size of the pupil. The sphincter pupillae closes the pupil and the ligator pupillae opens it. The inner layer of the eyeball, which is known as retina. Grossly, the retina consists of three parts: the optic part, the ciliary part, the iridial part. The optic part of the retina, which resists the visual light rays, has two layers, a neural layer and pigmented cell layer. The neural layer is the light receptive part. The pigmented layer consists of a single layer of cells that reinforces the light absorbing property of the choroid and reducing the scattering of light in the eye. The ciliary and iridial parts of the retina are anterior continuation of the pigmented layer and the layer of supporting cells over the ciliary body and the posterior surface of the iris, respectively. In the fundus, which is known as the posterior part of the eye, is a circular depressed area known as the optic disc, which is known also as the optic papilla, where the optic nerve enters the eyeball. Because it contains nerve fibers and no photoreceptors, the optic disc is insensitive to light. Just lateral to this blind spot of the retina is the macula lutea, which resists the name of yellow spot. The yellow color of the macula is apparent only when the retina is examined with red free light. The macula lutea, a small oval area of the retina where the special photoreceptor cones, is specialized for acuity of vision. It is not normally observed with an ophthalmoscope. A device uh, for viewing the interior of the eyeball throughout the pupil. At the center of the macula lutea is a depression, the fovea centralis, the area of the most acute vision. The fovea is approximately 1.5 millimeters in diameter. Its center, the foveola, does not have the capillary network visible elsewhere deep to the retina. The functional optic part of the retina terminates anteriorly along the ora serrata, an irregular border slightly posterior to the ciliary body. The ora serrata marks the anterior termination of the light receptive part of the retina, except for the cones and rows of the neural layer. The retina is supplied by the central artery of the retina, a branch of the ophthalmic artery. The cones and rows of the outer neural layer receive nutrients from the choriocapillaries. A choriocapillary layer, the finest vessel on the inner surface of the choroid against which the retina is pressed. A corresponding system of retina veins unites to form the central vein of the retina. The refractive media of the eye. On their way to the retina, light waves pass through the refractive media of the eye, cornea, aqueous humor, lens, and vitreous humor. The cornea is the circular area of the anterior part of the outer fibrous layer of the eyeball. It is largely responsible for the refraction of the light that enters the eye. It is transparent, avascular, and sensitive to touch. The cornea is supplied by the ophthalmic nerve and is nourished by aqueous humor, tears, and oxygen absorbed from the air. The aqueous humor in the anterior and posterior chamber of the eye is produced by the ciliary process. This clear watery solution provides nutrients from the avascular cornea and lens. After passing throughout the pupil from the posterior chamber into the anterior chamber, the aqueous humor drains into the scleral venous sinus at the iridocorneal angle. The lens posterior to the iris and anterior to the vitreous humor of the vitreous body is a transparent biconvex structure enclosed in a capsule. The lens capsule is anchored by the suspensory ligament of the lens to the ciliary body and encircled by the ciliary process. The convexity of the lens, particularly its anterior surface, constantly varies to focus near or distant objects on the retina. The ciliary muscle in the ciliary body changes the shape of the lens, and this way the isolated unattached lens assumes a nearly spherical shape. Stretched within the circle of the relaxed ciliary body, the attachments around its periphery pull the lens relatively flat so that its refraction enables far vision. When parasympathetic stimulation causes the smooth muscle of the superior ciliary body to contract, the circle, like a sphincter, becomes smaller in size, and the tension on the lens is reduced, allowing the lens to round up. The increased convexity makes its refraction suitable for near vision. In the absence of parasympathetic stimulation, the ciliary muscles relax again and the lenses go into its flatter, far vision shape. The vitreous humor is a watery fluid enclosed in the meshes of the vitreous body, a transparent jelly-like substance in the posterior 4/5 of the eyeball, posterior to the lens, postremal or vitreous chamber or posterior segment. In addition to transmitting light, the vitreous humor holds the retina in place and supports the lens. The muscles of the orbit. The muscles of the orbit are the levator palpebrae superioris, 4 recti, which are the superior, the inferior, the medial, and lateral. The 2 oblique, which are the superior and inferior. These muscles work together to move the upper lids and eyes. The attachment nerve supply right. Let us continue with these attachments and let us a little bit later. Levator palpebrae superioris is thin, flat elevator muscle of the superior eyelids broadens into a wide aponeurosis and it approaches its distal attachment to the dorsal blade. This muscle is the opponent of the orbicularis oculi, the sphincter of the palpebral tissue. The recti and oblique muscles. The fold recti arises from fibers of the common tendinous ring that surrounds the optic canal and part of the superior orbital tissue. The structures that enter the orbit through this canal and the adjacent part of the tissue lie at first in the coronal recti. The lateral and medial recti lie in the same horizontal plane, and the superior and inferior recti lie in the same vertical plane. All four recti muscles attach to the sclera on the anterior half of the eyeball. The actions of the recti muscles are: the medial and lateral recti rotate the pupil medially and laterally respectively. The superior rectus rotates the pupil superiorly, which is elevation. The inferior rectus rotates the pupil inferiorly, which is the depression. Neither the superior rectus nor the inferior rectus pulls directly parallel to the long axis of the eyeball. As a result, both recti tend to rotate the pupil medially, which is the adduction. This medial pulse of the superior and inferior recti is normally balanced by a similar tendency of the oblique muscles to rotate the pupil laterally, which is the abduction. The inferior oblique directs the pupil laterally and superiorly. Therefore, when it works synergically with the superior rectus, superior movement of the eyeball occurs. Similarly, the superior oblique directs the pupil inferiorly and laterally. Therefore, when it works synergically with the inferior rectus and inferior movement results. Facial sheath of the eyeball, which is known as the bulbar sheath, the term capsule, envelopes the eyeball from the optic nerve to the cerebellum, the corneoscleral junction, forming the actual socket for the eyeball. The facial sheath is pierced by the tendon of the extraocular muscle and is reflected onto each of them. As a tubular sheet, there are triangular expansions from the sheets of the medial and lateral rectus muscles called the medial and lateral check ligaments, which are attached to the lacrimal and zygomatic bones respectively, limiting abduction and adduction. A bleeding of the check ligaments with the fascia. Let me correct this. A blending of the check ligaments with the fascia of the inferior rectus and inferior oblique muscles forms a hammock-like sling, the suspensory ligament, which supports the eyeball. A potential space between the eyeball and the facial sheath allows the eyeball to move inside the cup-like sheath. A similar check ligament from the fascia sheath of the inferior rectus retracts the lower eyelid when the gaze is directed downward. Because the sheath of the superior rectus and levator palpebrae superioris are fused, the upper eyelid is elevated when the gaze is directed upward. Now we continue with the innervation. The innervation to the optic nerve. The nerves of the orbit includes those that enter throughout the superior orbital tissue and supply the ocular muscles, the oculomotor, the third, the trochlear cord, the afferent, the sixth. The CN3 supplies the levator palpebrae superioris, the superior rectus, the medial rectus, the inferior rectus, and inferior oblique. The CN4 supplies the superior oblique. The CN6 supplies the lateral rectus. All muscles of the orbit are supplied by the CN3, except for the superior oblique and lateral rectus, which are supplied by CN4 and 6, respectively. Several branches of the ophthalmic nerve pass throughout the superior orbital fissure, like the CN5, and supply structures in the orbit. The lacrimal nerve arises in the lateral wall of the cavernous sinus and passes to the lacrimal gland, giving branches to the conjunctiva and skin of the superior eyelid and providing secondary motor fibers conveying to it from the zygomatic nerve, CN5. The frontal nerve divides into the supraorbital nerve and supratrochlear nerve, which supplies the upper eyelid, forehead, and scalp. The nasociliary nerve, the sensory nerve of the eye, supplies several branches to the orbit. The infratrochlear nerve, a terminal branch of the nasociliary nerve, supplies the eyelid, conjunctiva, skin of the nose, and lacrimal sac. The ethmoidal nerves, also branches of the nasociliary nerve, supply the mucous membrane of the sphenoidal and ethmoidal sinuses and the nasal cavities and the dura of the anterior cranial fossa. The short ciliary nerves, branches of the ciliary ganglion, carry parasympathetic and sympathetic fibers to the ciliary body and iris. The ciliary ganglion is a small group of nerve cell bodies between the optic nerve and lateral rectus toward the posterior limit of the orbit. The short ciliary nerves consist of postsynaptic parasympathetic fibers originating in the ciliary ganglion, afferent fibers from the nasociliary nerve that pass throughout the ganglion, and postsynaptic sympathetic fibers that also pass through it. The long ciliary nerve branches of the nasociliary nerve CN5 transmit postsynaptic sympathetic fibers to the dilator pupillae and afferent fibers from the iris and cornea. The vasculature of the orbit, the arteries of the orbit. The blood supply of the orbit is mainly from the ophthalmic artery. The infraorbital artery also contributes flow to this region. The central artery of the retina, a branch of the ophthalmic artery, inferior to the optic nerve, runs within the dura sheath of the optic nerve until it approaches the eyeball. The central artery pierces the optic nerve and runs within it to emerge at the optic disc. Branches of the central artery spread over the internal surface of the retina. The terminal branches of the central artery are in arteries that provide the only blood supply to the retina. The retina is also supplied by the capillary layer of the choroid, the choriocapillary layer, which is also known as lamina, of the A of the posterior ciliary arteries. Also branches of the ophthalmic artery, 6 short posterior ciliary arteries direct supply the choroid, which nourishes the outer non-vascular layer of the retina. 2 long posterior ciliary arteries, one on each side of the eyeball, pass between the sclera and choroid to anastomose with anterior ciliary arteries. Continuation of muscular branches of the ophthalmic artery supplying the ciliary plexus. The veins of the orbit. Venous drainage of the orbit is throughout the superior and inferior ophthalmic veins that pass throughout the superior and orbital fissure, enters the cavernous sinus. The central vein of retina usually enters the cavernous sinus directly, but it might join one of the ophthalmic veins. The vortex or vorticose veins from the vascular layer drain into the inferior ophthalmic vein. The sclera venous sinus is a vascular structure encircling the anterior chamber of the eye, throughout which the aqueous humor is returned to the blood circulation. Take a look at your atlas, right? Everything related with the eye, the central artery, the retina. Take a look at the ophthalmic vein, right? Take a look at the transverse section of the optic nerve, the superior view. Take a look at the individual anatomical actions of muscles and study it anatomically. Take a look in your atlas, the innervation of the muscles of the eye. Don't forget to check the nerves of the orbit, right? The orbital parts of the frontal bone, right? Let us just take a break and we'll be back shortly. 1, 2, 3.